053 914 5222 is our common number. Okay, we've got lots of listeners' questions at the moment, and I'm going to throw a few of these at you. You're a very, very busy and very, very popular lady on this morning's show. My words are concerned about animals' welfare during this hot spell.
Animals they can't regulate their body temperature very well, so the heat affects them a lot. So what we need to do is make things as comfortable as possible for them. The other thing, don't exercise your dog in the high sun of the day, because they're just not able for it. Try early morning or late evening. Did you say weeing and drinking, is it? Weeing and drinking. Okay, polyuria, polydipsia, that's what that's called. And there's a few conditions that can cause that. Diabetes is the bigger one, especially if it's an older pet, and females seem to be overrepresented in this area. The animal will just drink constantly out of a bowl and will just be incontinent or maybe wee all the time. What I like people to do is to measure the water intake. Get an old 7-Up bottle in the morning, fill that up, and tell everybody if they're giving the dog water that they need to give it out of that, so that we can then decide with the weight of the dog, etc., how much the dog is actually drinking. They need to bring in a urine sample when they're coming in. They need to go to a vet, obviously, to bring in a urine sample, and we can do a urine analysis on that and see if there's any glucose in the urine. The other thing we do, obviously, is the blood tests. Kidney disease is another one for the older dogs, but again there's other symptoms like not eating, losing weight, things in that line. The dog just not well. Again, drinking a lot of water. The blood test will show us that there's kidney problems. Another hormone disease called Cushing's. Drink a lot, wee a lot. In some cases they have skin disease as well. They can have loss of hair or on the back, or they can have enlargement of the liver, kind of a drooping pot belly. And you do an MRI scan? So is it expensive? MRIs, yes. Well, we wouldn't do them ourselves. There's a place in Dublin, actually UCD, I think there may be another place, and the guys we use are in Cork, an orthopaedic surgeon that we use frequently, and they have a travelling MRI, or a mobile MRI as I say, and that takes the scans of the dog. They have to actually be knocked out for that, because you know, if anybody's ever had an MRI done, you go into a little kind of a tunnel, so it can be quite frightening for people, and some people need to have a little sedative before. I've had it done, and it is quite frightening. Yeah. So the dog's actually. And would you believe it's a Cavalier King Charles? They've really every Cavalier King Charles owner in the county is counted. Okay, next question concerns a half terrier, half Shih Tzu, very itchy, gets an injection every 3 months for the itching. It's an allergy, but the injection doesn't work for long, and the dog is 4 years old. At this time of the year, as we talked about earlier, ATP is the big one, and sometimes the injection will work, but again it wears off. There are other treatments like Atopica if it's that particular allergy, and it's a tablet you give once a day, and there's no real side effects. I'm presuming the injection that it gets every 3 months is a kind of a depot steroid, and that does stop itching, but again it wears off. And that was of course Annette there, Annette Quigan of PetVet Wexford, and you're awesome. We'll have to visit again shortly.